Hello friends, in this session we will talk about uh, eyelids chapter part 1, that is blepharitis, Chalazion and the lug of thalmus. So coming to blepharitis, which is the inflammation and infection of the eyelids. So the blepharitis, seborrheic, staphylococcal or ulcerative, posterior or mebomitis, and parasitic. So coming to seborrheic or squamative blepharitis. So in this kind of blepharitis, we will see the squamous metaplasia, where the cause of the lid margins will change into the squamous epithelium because of repeated infections via staphylococcus. So cause for all the types of blepharitis except parasitic will be staphylococcus only. So in this case, the signs and symptoms. So we can see there will be the eyelid with dandruff will be there, or the scales. And when it comes to the symptoms, it will be foreign body sensation, that is photophobia, phonophobia, irritation, itching, lacrimation, falling of eyelashes. And in the pathology of this condition, there will be or the moles glands that will be split off by the Corynebacterium acne. So the fatty secretions from the meibomian glands will be split off by this organism, that is Corynebacterium acne. And when it comes to the diagnosis, it will be culture sensitivity and antibiotics based on the discharge that is coming out of the lids, mostly mucopurulent discharge. So treatment will be the steroids and antibiotic therapy, eye patching with ointment, and tarsorrhaphy, along with, to remove the dandruff, baby shampoo can be used. Coming to the staphylococcal or ulcerative blepharitis. So due to the repeated epithelial trauma by staphylococcus, there will be damage to the epithelial cells, because of which, most importantly, yellow crusty lesions will be seen, and foreign body sensations are mentioned. So because of the pus that collects in the lids, there will be trichiasis or dystrichiasis, and due to repeated epilation, there will be mudorosis or loss of ciliary grain. Right. And most important, in all the conditions, we should avoid contact if possible. And giving a gland eversion through a vertical massage is also done. Then posterior or mebomitis, as I've told, staphylococcus is the cause already. And here we can see, most important, the vertical yellowish streaks in the eyelid, and there will be shiny margins in the conjunctiva. And coming on to the parasitic blepharitis, this is by the crab louse or mite, where we can see nits on the eyelashes, and that can be removed by forceps or manual epilation with or steroid ointments. And last but not, and next we have the Chalazion, which is the chronic granulomatous inflammation of the meibomian gland. So in Chalazion, right, so as I said, it is an infection of the meibomian gland by an organism, commonly staphylococcus. So because of which there will be epithelial damage, and there will be the metaplasia, which is transformation into the squamous cells, and the healing of the epithelium will happen pathologically by activating the stem cells to form epithelial tissues. Yes, and that is due to the excited inflammation in the gland. So because of more amount of cells building up, it may lead to a carcinoma like condition. So meibomian gland carcinoma and calcification will be the complications. So calcification is because of the splitting of the fatty secretions from the meibomian glands by the saponification process, which involve a soapy precipitate in that case. So we can see a small, firm and painless, non-tender swelling in the lower part of the lids, and we can see a marginal chalazion where there is a reddish grey nodule that is present. So treatment will be antibiotics, steroids, analgesics to treat the infection, and apart from that, hot fomentation and diathermy can be done. incision and curettage is method in Chalazion. So what we do is make a vertical incision in the Chalazion, scoop out the contents through the curette and reposition the flaps back of the Chalazion. And last but not the least, we have logophthalmos, where there is a delay in the or lid lagging. There are various causes of logophthalmos, but the common ones include Bell's palsy, Graves' disease, ptosis correction, then neuromuscular disorders, orbicularis oculi muscle paralysis, and leprosy. So we can observe clearly the eyelid doesn't close properly. So because of that exposure keratitis, the conjunctiva and cornea gets damaged, because of which there will be dryness in the eye, and that's why we give the eye ointments, tear drops, patching of the eye with tarsorrhaphy. So that's it for part 1. Thank you so much. We will see in the next lesson.